From the offices of Toledo Cardiology Consultants with Dr. Ameer Kabour, President and CEO, this is Time Waits for No One. Today, the effects of smoking on your health, lung cancer, and COPD diagnosis and treatments with Dr. James Tita from Respiratory Specialist of Toledo. Next on Time Waits for No One.
Hi. It's my pleasure today to follow up on the previous episode, which we discussed smoking and the danger of the smoking. And as we promised, we're going to show in this episode the prevention and treatment of the possible complication from smoking. It's my pleasure to welcome Dr. Jim Tita, who is the director of the intensive care unit in Mercy St. Vincent Hospital. And welcome, Jim.
Thank you, Dr. Kabour.
We discussed before in the previous episode all of the danger about the chemical and the side effect and complication coming from smoking. And the most common things we always hear and discuss is what we call COPD or obstructive lung disease. If there's any way you can just in a simple way describe what is COPD to the patients.
Well, COPD is a chronic progressive lung disease that affects primarily the bronchial tubes. It makes it difficult to breathe. It's associated with excess sputum production. As the disease progresses, it affects the entire body. Patients begin to lose weight. They have difficulty eating. And they progress to the point where they have difficulty with their activities of daily life.
And how many years of smoking the patients needs before developing COPD? If there's any relationship between the two?
Well, there is. It's certainly not an exact science, but in general what we say is patients need to have approximately about 10 years of smoking a pack of cigarettes per day. And, but there's really no known threshold. And certainly there are some patients that smoke more than that and do not develop severe lung disease, and there are patients that barely reach that threshold and they have very severe disease. So there's probably genetic factors that are involved as well.
And what are the early signs which is the patient should watch, like giving him a clue, maybe I'm in trouble, I should go and talk to my family doctor and talk to the specialist about their lung problem? I mean, what are the early signs of COPD?
Well, probably one of the earliest signs is cough. You know, most folks who smoke have a morning cough and they kind of ascribe it to their cigarette smoking, and that is in fact true, but that can be one of the earliest signs. Shortness of breath. They may notice that it's more difficult for them to climb a flight of stairs. They may have difficulty shopping. They may notice that they have to hang on the cart as they go up and down the aisles. And again, the natural response to that is, well, you know, I'm out of shape, or they ascribe it to some other problem. And frequently, by the time they get to a physician, their disease is far advanced.
There's any relationship also between secondhand smoking and COPD?
There probably is. The problem is it's difficult to quantify. You know, we quantify smoking by the number of packs of cigarettes over a period of time. With secondhand smoke, it's more difficult because it's difficult to quantitate the amount of exposure, whether it's a small room, a large room, the duration of exposure. But unquestionably, we know that secondhand smoke is not good, especially for children. We know for sure that children who grow up in households that have one or two smokers lifelong have a decrease in their lung function. They have a higher incidence of ear infections and are at greater risk to develop COPD as they get older.
When we are talking about the COPD, we know that it's coming from smoking, and we know also the relationship between smoking and lung cancer. Does the patient who has COPD has higher risk of cancer?
Yes. In fact, if you have COPD, your risk of lung cancer is even greater than in smokers who don't have COPD. So they're additive risk factors.
Okay. What about the possible test when the patient's coming to you and require further testing and further evaluation? What are the most common tests which we should do for the patients who are questionable COPD patients?
Well, the single most important test would be a breathing test or a spirometry. That's where the patient blows into a tube and we actually measure their flow rates and capacities. Because the hallmark of patients with COPD is they have a restriction or obstruction to airflow, and we can actually quantitate that based on this test. And of course, a chest x-ray is a good idea as well.
Is the COPD curable?
It's not curable. It is treatable, however. And the most important part of treating the disease and halting the progression is smoking cessation.
Mm-hmm. And when we are talking about the treatment other than smoking cessation to probably stop the progression of the disease, what type of treatment currently available for most of those patients?
Well, we have a number of medications which relieve symptoms, that is, make breathing easier. In general, they're inhaled medications. They come in a variety of different types. And frequently, patients are on several types of medication for the same symptoms. But there are a number of medications that can be used. Also, it's important to utilize preventative measures. So patients who have COPD are at particular risk for infections. They're at risk for the complications of influenza, pneumonia. So those vaccinations are very, very important.
Good. So really what I understand from what you're saying, basically the patient with COPD are at higher risk for possible infection, and they should get the vaccination the way you are describing it.
Absolutely.
Okay. Now, regarding the COPD management, we know that the patient, they are on multiple inhalers, and some of it is steroids, some of it anti-inflammatory, some of it, and also that concept of steroid treatment for the COPD. I mean, we know that there's some patients are going to be on it, and the patients are fearful of using steroid in general. There's any way you comment on that? I mean, how important it is?
Well, prednisone, which is a steroid, can be useful in patients who have acute exacerbations or a flare of their lung disease. However, the problem with long-term steroids is that they have many adverse side effects. So generally what we do is we use them in short courses. Now, we do have a novel way of delivering steroid medication to the lower airways, and these are through inhalers. And these are formulations of steroids that are not absorbed appreciably into the body, so they don't have the same side effects that taking steroids either by vein or by pill would have.
Now, the last question regarding the COPD, when we tell the patient you should quit smoking, and he will say, oh, okay, I already developed COPD, what's the benefit of stop smoking? Now, there is a scientific evidence that stop smoking is going to help that patient on the long run. Minimum, he will live healthier, he will live longer, and at the same time, he will not develop the complication, which is most of the people end up with severe COPD at the end of their life.
That's correct. It's never too late to quit smoking. And while it's true that you won't gain back all the lung function that you've lost, instead of losing lung function, though, at an accelerated rate, you will go back to losing lung function just a small amount every year because of the normal aging process. So you reverse that downhill slope, so to speak, by quitting smoking.
And definitely, it's better to stop smoking before you have COPD.
Absolutely.
Okay, great.
Every cigarette is doing you damage. Lungs are like sponges with millions of tiny air sacs for transferring oxygen. Every breath of tobacco smoke attacks them. No wonder smokers feel short of breath. Their lungs are rotting. This is a healthy lung. And this is the amount of tar a pack-a-day smoker breathes in every year. Every cigarette is doing you damage.
Smoking causes oral cancer. If it didn't, I wouldn't be needing chemotherapy.
If looking at mouth cancer on your cigarettes makes you uncomfortable, look at another part of the pack. Quitting is hard.
not quitting is harder.
We call it throat cancer. They've come in and removed my voice box. Before we did this, they found out I got lung cancer as well. And the future plans right now are Alexander, my oldest, is coming over here for holiday December 13th. I will be alive for that.
Just like you. And the cats in the cradle and the silver spoon, little boy blue and the man in the moon. When you're coming home, Dad, I don't know when, but we'll get together then, son. You know we'll have a good time then.
On average, every hour of every day, an Australian dies of heart disease caused by smoking. That's right. Smoking.
You know we'll have a good time then.
Smoking. It's heartbreaking.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Getting men to change their lifestyle is leaving their wives and children very frustrated. Men seem to think that medication is the fix. It's like putting medications in the big cheeseburger and expecting to be healthy. Come on, guys, you can do it, one step at a time.
To learn more, go to WTOL.com Health Track.
Because time waits for no one.
Here again is Dr. Ameer Kabour and Dr. James Tita on the subject of lung cancer.
The second subject we're going to discuss today is related to the damage caused by smoking, specifically lung cancer. As we discussed before, smoking is related to too many cancers, but the most common one, and probably very well known, is the lung cancer. Dr. Tita, I want you to explain to most of our patients the relationship between smoking and lung cancer. How significant?
Well, it's very significant, and probably about 85% of lung cancers are associated with smoking. Now, having said that, we don't know the exact mechanism, what it is in cigarette smoking, what substance that causes lung cancer, and of course, this is an area of intense research. But it is clear that that is the single biggest risk factor to develop lung cancer.
And again, if there's any relationship between the length of smoking and the danger of developing cancer?
There is. Generally, we think that there's a threshold of about 10 pack years, or smoking 1 pack a day for 10 years. But again, this is not an exact science. However, it is known that the longer you smoke and the heavier you smoke, the greater your risk for lung cancer is.
I missed asking you also about the COPD and lung cancer, if there's any genetic factor or family history relationship with COPD and lung cancer.
There is definitely genetic factors, and again, this is an area of intense research. We're learning more and more about some of the genetic markers of lung cancer, and we're actually involved in an exciting study here in Toledo, out of the University of Toledo, where they're looking at markers within bronchial secretions that predict the risk of developing lung cancer. We know that patients who have close relatives who have had lung cancer are themselves at greater risk to develop lung cancer, especially in the setting of smoking. So there's definitely a familial component.
Now, if we have some patients who are interested in getting involved in these kind of studies, I mean, you just mentioned about it, there's any specific way they can reach you guys? I mean?
Well, we are actually one of the sites. This is a NIH, National Institute of Health trial that's going on. Dr. James Willey is the principal investigator, and I'm one of the sub-investigators, and certainly you can call either facility and we would be happy to give you more information about this.
And probably we will show the phone number for the research center,
Yep.
which is Dr. Tita involved toward the end of the episode, so everybody who's interested can call. The next question are, what is the most common symptoms and signs the patient should be concerned, I mean, as an early sign for possible lung cancer?
Well, lung cancer can be rather sneaky, and most patients have no signs at all. But of patients that do have signs, probably the most common would be cough, and specifically coughing up blood. They call that hemoptysis. You may notice pain that you didn't have before, subtle findings such as losing weight, getting more short of breath, having more difficulty doing daily activities, are some other symptoms that occasionally occur.
Now, I know also that there is different kind of lung cancer, I mean, and we, based on that difference, the cure is different.
That's correct.
So if there's any way to give us just a summary about what kind of cancers which we are talking about?
Well, there are actually 5 different cell types, but really for the sake of treatment, we refer to them as either the small cell type or the non-small cell type. In general, the non-small cell types are best treated with surgery, removing that part of the lung where the tumor is, provided it hasn't spread anywhere. The small cell type, which is sometimes referred to as the fast-growing type, is typically treated with a combination of chemotherapy and radiation.
Now, the early detection and the early treatment definitely will increase the chance of cure?
That's correct. The earlier that we can identify it, the less chance that it has spread. Unfortunately for lung cancer, for about 85% of patients, by the time they get to the doctor, it's too late. It has already spread and is not curable.
And that's why it's so important to mention to the patients, as soon as you start noticing any symptoms or signs, I mean, when we are talking about coughing, when we are talking about some weight loss, when we are talking about some blood in your phlegm, or it's so important immediately to see your family doctor and probably the pulmonary specialist, because they are the only one who can identify this cancer as soon as possible, treat it at the right time, and in that case, your chance of cure is much higher. What are the, I mean, you mentioned the surgery for the lung cancer, and we talked about chemotherapy and all of that stuff. But again, I want to go back, as we discussed with the COPD, it's better to stop smoking at the right time and prevent yourself from going into lung cancer. So stop smoking before they develop lung cancer. That will reduce their chance of developing cancer in the future?
Absolutely, absolutely. And the longer you stop smoking, the less your risk becomes. And by about 10 to 15 years, your risk of developing lung cancer approaches that of somebody who never smoked.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is my outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
Coming up next, why is it difficult to quit smoking? And the steps you can take to stop.
Now, we discussed the harm of smoking. And we always tell our patients that you should stop smoking to prevent yourself from having COPD, from having cancer, at the same time from having heart problem. And we know how difficult it is for most of the patients to quit smoking. Can you elaborate a little bit with us about why it's difficult for the patient to quit smoking?
Well, nicotine is very addictive. And especially when you start smoking before you're 21, there are studies that show that actually nicotine assimilates in the brain chemistry permanently. And it makes it very, very difficult to quit smoking. Not only that, we have all kinds of cues in our culture which help people and keep reinforcing the notion of cigarette smoking, both subtle and not so subtle clues. Having said that, though, lots of folks have successfully quit smoking, and it's difficult. When I talk to them, it's among the most difficult things that they've done. But in terms of their health and well-being, it's probably the most important thing that they can do.
Now, I want to go back to that point you mentioned earlier, which is related to the age of start smoking. And, you know, when our kids, you tell them you need to quit smoking, you shouldn't smoke, they tell, oh, I can stop at any time. All of this argument is really not accurate, and I want to emphasize on that point. So smoking at younger age, it will make it much more difficult to quit smoking at older age.
Right. There's evidence that indicates that for teenagers, after smoking only a month, it becomes difficult for them to quit. They're particularly susceptible to the addictive effects of nicotine. And you know, it's the problem is, you know, cigarette smoking, for better or for worse, has sort of become emblematic in our culture of that age-old teenage struggle between rebellion and conformity, rebellion against your parents and conformity with your peers. But unfortunately, when they get over that phase, they're addicted. And we know that the long-term quit rates for cigarette smoking are very low, only in the range of 20%. And so virtually 80% of teenagers who begin smoking will die smoking.
Yeah. And if there's any major contributing factor which lead the people to start smoking, because we want them not to start so they will not worry about quitting. So if there's any scientific data suggesting that specific group of people are at higher risk to start smoking?
Well, teenagers for certainly, and I mean that has to do with much of the marketing that goes on by tobacco companies. You know, this feeling of wanting to be sophisticated, rebellion, individual autonomy, all of those very kind of complex feelings that teenagers are particularly vulnerable to. We also know that if you grow up in a milieu where you have cigarette smokers, it's more likely that you will smoke cigarettes. And so obviously if your parents smoke, if your relatives smoke, if your siblings smoke, that's a big risk factor.
Very good. And also it's reported in the literature, to my understanding, that the people who have anxiety and depression and some other major medical problems like accidents, and they are depressed, and the people who had, you know, many medical problems, they end up basically because of their stress factor at higher risk to start smoking at older age, definitely comparing to the younger age.
Yep, that's correct. I mean, nicotine is a fascinating drug. Unfortunately, the way it's delivered by smoke, it becomes very addictive.
Now, when we tell the patients about quit smoking, we know that there's two approaches we try to help them with. The first one is the behavior treatment or behavioral approach, and the second one is the pharmacological or the medications approach. Can you tell us some more information about those two approaches?
Well, certainly there's no one single way that is better than any others. And the best way is the way that works for a particular patient. The most common way would be cold turkey, where you just stop. We have a smoking cessation counselor who works in our office, and she's often said that people quit smoking for their own reasons. And it has to be something personal, and it has to be something that they internalize. And it may be something as silly or what seems to be as insignificant as I painted my house and I got new drapes and I want to keep them clean. It may be the realization that they've got an important life event, and such as a marriage or birth or graduation, and they want to do everything they can to make sure that they make it to that particular day. But that's probably the most important thing. Studies have shown that patients need to really make that decision that they want to quit. And then after that, I mean, I think we as healthcare providers can help them. And there are a variety of different ways. As you mentioned, the pharmacologic ways, either the nicotine replacement, there's the gum, the patch, there's a nicotine inhaler. There are medications which work on decreasing the cravings to smoke, such as Chantix and Wellbutrin or Zyban. There are behavioral modification techniques. They call that aversive behavior. There are a whole variety of things. The American Lung Association, the American Heart Association, all have programs. I have a number of patients who have successfully quit with hypnosis, acupuncture. It doesn't work on everybody, but for those that it does, it's successful.
But probably the most important point you just mentioned, that failing in one modality, it doesn't mean that you are going to fail into the other. You could try one and you should try the second one, you should try the third one. As long as you have the intention to quit smoking, that is really the most important step. And choosing one of the other modality with your medical professional people who are helping you, it will be tremendously helpful. What about having a support group? I mean, joining a support group when you are trying to quit smoking, is that helpful?
Yes, I think it is. You know, I mean, it's an addiction model similar to other addictions, and we know that the group process can be very, very powerful. And especially patients get discouraged, they fall off the wagon, and so it's important to have a supportive group, a group of people that shares this with you and can help you through the rough spots.
Absolutely. And I want to bring to the viewer attention that I always seen some patients who are having a heart attack and they have the intention to quit smoking, and after 6 months they come back and when we ask why you are back to your cigarette, he say, my wife is still smoking in the house or my son's still smoking in the house. So that environment which is surrounding the patient is so important. I mean, we need the family support and we need the community support to get to the bottom line of this problem, and hopefully all of the patients will quit. Jim, I really appreciate it. It was very informative, very helpful, and I hope we helped our viewer, and hopefully we'll see you again.
Thank you.
So no matter who you are, take this moment to think about yourself, your future, your kids, and the rest of the family. Do not find excuses to continue smoking, but find the courage to stop. Do not find the reason to continue, but find the reason to stop. Quit today, not tomorrow.